There is uncertainty over the future of some programs in Colorado Springs serving the homeless and those struggling with substance abuse. News 5's investigative reporter Allison Zimmerman explains the changes.
There's a few variables to this equation. There's concern over federal dollars not coming in, and a change is happening at the state level with the Behavioral Health Administration that could impact where money goes for services for vulnerable populations here at home. The city's homeless population has been a focus in Colorado Springs. There's been a push to get people into programs that can help get them housed and also address issues like substance abuse.
It definitely weighs on providers in this community to figure out how we're going to continue to do what we do.
Katie Blickendorfer is the Chief Clinical Officer for Diversus Health. It's a mental health provider in Colorado Springs.
The question mark on the table is whether or not the funds will be cut from the federal government and therefore impact communities.
Diversus is impacted in a couple of ways. Currently, Diversus Health has been the go-between, more officially the intermediary for issuing state and federal dollars to providers to help people who are underinsured or not insured. When the new fiscal year begins on July 1st, Diversus will no longer be that go-between. The state is moving to a different regional model. Instead, Signal Behavioral Health Network will be in charge of distributing money for programs here at home, like Sober Living.
The intent is for it to be seamless with providers that, instead of recontracting with us, their contracts will be with Signal Behavioral Health. The challenge is whether or not the funding will exist like it has been.
So does this mean those programs will be going away?
We really don't know at this point.
Diversus says it did not apply to be the new go-between because it's focused on being a provider, not what's known as a managed service organization. But contracts under this new model are not all finalized yet, even with the transition happening July 1st.
I think the budget challenges are not going to go away anytime soon. So I suppose, yes, it's correct to say that there is risk.
Daniel Darting is the CEO of Signal Behavioral Health. He says this all comes down to streamlining care for people who need it most.
There's been so much change that has happened in recent years in healthcare in general and behavioral health specifically in Colorado. It's a lot for the provider network to manage.
There have been funding challenges. The state has its own budget deficit lawmakers worked through this legislative session. On the federal funding side of things, cuts are not happening right now, but federal dollars are running out from COVID-era relief like the American Rescue Plan Act.
So there's an indirect relationship, but it's not an arbitrary reduction of funding or a decision-based reduction of funding or changes of that kind that we're aware of.
I followed up with Signal to see if we could learn which providers it will contract with. It said that is still in progress, but it is their intention to continue working with most, if not all, of the programs that have offered these services in the past, and that goes for El Paso, Park, and Teller counties. The State Behavioral Health Administration says more announcements will be made in the coming weeks about just what this new system will look like for patients. We'll follow up to show you how this will all work. Allison Zimmerman, News.